Follow and subscribe Stenolab India for correct pronunciation, accurate speed and clear voice. AIIMS and SSC Dictation 800 words. Exercise number 3. Speed 80 words per minute. Start. Hygiene and sanitation are the backbone of any effective healthcare system. In India, where public health infrastructure faces various challenges, maintaining cleanliness and ensuring proper sanitation in hospitals is not just a matter of aesthetics, but a critical necessity for patient safety, infection control, and overall healthcare quality. With the increasing burden of infectious diseases, antimicrobial resistance, and high patient influx, the importance of hygiene in Indian hospitals has never been more pressing. Hospitals are places where people come to recover from illnesses, injuries, and surgeries. However, without proper hygiene and sanitation measures, hospitals themselves can become breeding grounds for infections. One of the biggest risks in any healthcare facility is hospital-acquired infections, HAIRS, also known as nosocomial infections. These are infections that patients acquire while receiving treatment for other conditions. In India, HAIRS are a major public health concern, especially in overcrowded and under-resourced government hospitals. Poor sanitation, improper sterilization of equipment, and unhygienic handling by staff can all contribute to the spread of these infections. The importance of hygiene begins right from the hospital entrance. Clean floors, sanitized waiting areas, well-maintained washrooms, and proper disposal of biomedical waste are all essential components of a hygienic hospital environment. If basic sanitation facilities are not maintained, it not only increases the risk of disease transmission but also reduces public trust in the healthcare system. Patients and their families expect hospitals to be clean, safe, and sterile. A visibly dirty or poorly maintained hospital can deter people from seeking timely medical care, especially in rural and semi-urban areas. Healthcare workers, including doctors, nurses, and attendants, play a vital role in maintaining hygiene. Simple actions like hand washing with soap before and after attending to patients can drastically reduce the risk of infection. The use of gloves, masks, aprons, and proper sanitizers has become even more important in the post-COVID-19 era. In India, while some private hospitals have adopted high standards of cleanliness, many government hospitals still struggle due to staff shortages, lack of training, or inadequate facilities. Training healthcare workers in hygiene protocols must be made mandatory and regularly reinforced. In addition to staff hygiene, the sterilization of medical instruments and proper waste management is critical. Used syringes, surgical instruments, dressings, and biological waste must be treated as hazardous. If not disposed of correctly, this biomedical waste can pose a serious threat to hospital workers, patients, and the environment. The Biomedical Waste Management Rules 2016, framed by the Ministry of Environment, Forest and Climate Change, aim to ensure safe and scientific disposal of hospital waste. However, enforcement and compliance are still inconsistent, especially in smaller clinics and rural hospitals. Sanitation is not limited to cleaning floors and walls. It includes a systematic approach to water supply, drainage, waste disposal, pest control, laundry services, and kitchen hygiene in hospital premises. Access to clean and running water is fundamental for maintaining hygiene. Yet, in many hospitals in India, particularly in rural belts, the availability of clean water is unreliable. This hampers basic tasks, such as cleaning wounds, washing hands, or disinfecting surfaces. Without water and proper sanitation infrastructure, the risk of cross-contamination and disease outbreaks significantly rises. The impact of poor hygiene in hospitals can be severe. Patients may take longer to recover or develop secondary infections, increasing the duration and cost of hospitalization. In some tragic cases, lives are lost due to preventable infections. Moreover, infections acquired in hospitals often require stronger antibiotics, which accelerates the problem of antibiotic resistance, a growing public health threat in India. Thus, investing in sanitation is not just about cleanliness, it is about saving lives and preserving the effectiveness of medical treatments. Government initiatives like Swachh Bharat Abhiyan and Kayakalp have aimed to improve cleanliness in public health facilities. Kayakalp, launched by the Ministry of Health and Family Welfare, encourages public hospitals to maintain high standards of sanitation and hygiene. Under this program, hospitals are assessed and awarded based on their performance in cleanliness, hygiene, and infection control. While such initiatives have brought some positive changes, more consistent funding, monitoring, and community involvement are needed for lasting improvements. Patients and their families also have a role to play in maintaining hospital hygiene. Awareness campaigns can educate the public on the importance of not littering hospital premises, using toilets properly, and reporting unhygienic conditions to authorities. Hygiene should be a shared responsibility where hospital management, healthcare workers, sanitation staff, and the public work together to create a safe environment. In conclusion, hygiene and sanitation in Indian hospitals are foundational to delivering safe and quality healthcare. It is not merely a support service, but a life-saving component of healthcare delivery. With proper training, stricter regulation, public awareness, and investment in infrastructure, Indian hospitals can significantly improve their standards. A clean hospital is not a luxury, it is a necessity for a healthy India. Stop.